Hey, Dr. Callanan here. I wanted to quickly go through a patient's blood work discussing the primary causes that I see for individuals with fatigue. Now, this blood work is quite interesting because oftentimes I'm looking for the more obscure causes for low fatigue, like chronic infections, autoimmune conditions, thyroid related concerns, hormone imbalances. And I wanted to share these labs in particular because of the importance of really looking back to the basics. So sometimes we run organic acid testing to look for vitamins and minerals and all of these great comprehensive testing for chronic disease and mitochondrial function, when we just need to also remember that it's really important to go back to the basics that can make a huge difference. So in my practice, I always run comprehensive testing for patients, which includes functional medicine testing and basic blood work testing as well. And this is why still remembering to do the basic blood work is really important. So for this patient here, what you can see is the hemoglobin is particularly low. So hemoglobin is one of the markers that we use for evaluating anemia, which could be from many variety of different causes of nutritional deficiencies like B12 or iron. We are also seeing the MCV here is low, and this is the average size of the red blood cells hemoglobin amount. So they're really looking at the optimal size being around 90, and for this patient, it's also quite low. This could be due to things like B6, B12, zinc, copper, iron, because these are the nutrients that are needed to make heme. Now, one of the things that I really like about functional medicine is we take it a step further to say, okay, this patient's really struggling with nutrient deficiencies. We'll have a look at the B12 and iron a little bit lower. They are not within the normal range. We need to give that to the patient. We need to be very specific with the dose, how long she's going to take it for, and then repeat the blood work in 3 months to ensure it's come back up to the optimal range. While symptomatic relief is important with the supplementation, we have to look at why is it low? Are we seeing blood loss through heavier menstrual cycles? Is there an issue with absorption in the digestive tract? Is there chronic gut infections? Is there a lack of dietary intake, lack of digestive capacity? So it's not enough just to say, okay, take this dose of this particular form of iron for this amount long and we'll repeat. Really trying to get to the root cause is important. The other thing that I was starting to see for this patient, we're focusing mostly on the nutrient deficiencies that lead to low energy in this video, the basics. But one of the things I also noticed for this patient is her hemoglobin A1C is 5.4. I like to see it a little bit lower. This tells us about the overall 3-month average of blood sugar management. Individuals with insulin resistance can experience significant fatigue as well. This patient did have resistant weight loss, so having a look at how we can improve the blood sugar management will also be quite helpful. Electrolytes and liver looked good. The cholesterol panel was good. This is just going to be a quick video. A couple of the other things that we want to consider optimizing is the testosterone. We want to have a look at optimizing the vitamin D. This is a huge one. This should be anywhere from 100 to 150 in my experience. The thyroid panel looked pretty good. The free T3, I like to see it around 4, and she was 3.9. We are seeing slightly elevated anti-TPO antibodies. This tells us that there is an immune response to the thyroid gland. Having an autoimmune condition where your immune system attacks your thyroid gland is the most common reason for hypothyroidism. This patient, the antibodies are not really elevated that high. The anti-TPO antibodies are still fine. The overall TSH, T3, T4, the hormones look good. So what we're planning on doing is monitoring every 6 months to every year a full thyroid panel to see what happens. B12 versus at 234. I like to see it more around 500, so that's something we need to have a look at. Ferritin levels are particularly low, needs to be at the bare minimum 50, ideally around 80. This patient did ovulate this cycle because we saw a rise in progesterone, which is great. And if you're confused by these blood work and you're interested in learning more, I do have a full blood work presentation that I go through it slowly, as well as when you work with me one-on-one as a patient, we do go through this line item by line item and share additional diagrams so it's easier to understand. Typically, in terms of the hormones, I like to see the progesterone about 10% of the estradiol 7 to 10 days before the next expected period. So this patient does have a estrogen dominance picture. Correcting this could help with heavier menstrual cycles, clotting, etc. Inflammation is good. Cortisol was a little bit on the higher end. And the DHEA, which is an anti-aging hormone here, I forgot to mention, it's an androgen that falls in line with testosterone. I would like to see this a little bit higher. This could be causing some of the fatigue as well. So really starting on the basics first, what's going on? How do we get to the root cause? If the heavier cycles and the estrogen dominance are the root as to why the iron is lower, then fixing that as well as symptomatic release with the supplementations is key. So I hope that was helpful for you. Just a quick reminder that you also need to have a look at the basics and not underestimate how much anemia and low B12 and low iron and low vitamin D can really impact your overall energy levels.